Now we're going to talk about Chapter 14, Disaster Nursing. Okay, so that's a little bit about disasters, and then a little bit we're going to talk about disasters and what we do as nurses to prepare for them. All right, so we're going to discuss types of diseases including natural and human-made, evaluate the effect of disasters on people and their communities, and then describe the disaster management phases of prevention, preparedness, response, and recovery. So Zika is probably one of the newer ones that it's actually, you can consider that in the disaster preparedness area. And also diseases that come from natural disasters. So after recently the flooding in Louisiana, we had flooding recently here in Cincinnati, Ohio, in Norwood, Ohio, the earthquakes in Italy. So talking about what we do to prepare for that here. So the number of disasters, both human-made and natural, continues to increase, as does the number of people affected by them. The cost to recover from a disaster has risen sharply because of the amount of technology that has to be restored. Nurses are increasingly getting involved in disaster planning, response, and recovery through their local health departments or local government. So disaster, any natural or human-made incident that causes disruption, destruction, or devastation requiring external assistance. So they can range in size, they're expensive in many ways, lives affected, money loss, property loss, damage, and developing countries experience disproportionate burden from natural disasters than first world countries or first world. So types of disasters, here they're listed. There's natural disasters, human-made, chemical, biological, radiological, nuclear, explosive. So there are ways to prevent or manage how people in their communities respond to disasters. We can't prevent a disaster usually. We can prevent the response to that. So the number of live loss have decreased in the U.S., actually worldwide, because of the way we respond to disasters. And here are the different areas that respond to disasters. There's the U.S. Department of Homeland Security, the National Preparedness Guidelines, National Response Plan, etc. All right, so Healthy People 2020 had objectives pertaining to disasters, relating to unintentional injury, occupational safety and health, environmental health, and food and drug safety. So prevention, mitigation. Obviously, right, we want to prevent disasters, but we can't prevent natural ones. Some human ones we can't prevent because they're out of our scope or out of our hands. But we want to prevent the cycle of just disasters getting worse. So part of that involves preparedness. There's personal preparedness, right? Do you have a checklist? Do you have emergency supplies? Are we teaching people about personal preparedness? I know when I lived in California, that was the big thing. Make sure you have your emergency stuff when there's an earthquake, knowing what to do, having a plan with your family, having a meetup, a phone number to call. There's a lot more now out there. We have ways for people to go on the Health and Human Services site to get in touch with family members when there's a disaster. Do you teach your family what to do? So let's see, I live in Ohio, there's tornadoes. So teaching our kids at a young age, when you hear that siren, you go downstairs. When the fire alarm goes off, don't hide under the bed. Depending on their age, teaching them about what to do during a fire and starting that at a young age. Emergency supply kits and knowing, the different phone numbers to call. There's professional preparedness, disaster medical assistance teams. I know if any of you work in hospital, you've all had your drills. And then there's community preparedness. Role of the nurse in disaster preparedness. So let's step away from the personal and we're going to go into our role in the community. So help initiate or update the agency's disaster plan. Provide educational program and materials regarding to disaster-specific areas. One of those disasters that we now have to start planning on is active shooter training. Do you have active shooter training at your work? Do you have information on it? Do you know what to do? Do you help organize the disaster drills? And then providing updated record of vulnerable populations within the community. So these are the numbers of those who are critically limited in their mobility. If there was a fire, if there was a gas leak, if you needed to evacuate due to inclement weather. And then reviewing individual strategies for different clientele. So response. Here are the different types of response, and that's really important. The earlier you respond, the better you can stop the cycle of disaster. How do they affect communities? Physical and emotional effects depend on the type and cause and location, the magnitude and extent of disaster, the duration, and the amount of warning. There's stress reactions in the individuals, there's stress reactions in the community. I remember when I was in school, in graduate school, one of our teachers, when we talked about disaster planning, and she had survived Hurricane Superstorm Sandy. She is from the Manhattan area. She lives in Long Island and in Manhattan, and she was there during 9/11. She was there during Superstorm Sandy, and the way she talked about just the effects of that hurricane was pretty astounding to me because I just didn't think it was that bad, and it truly, truly was. So anyway, it's very interesting, just the stress reaction you can have from that. So the role of the nurse, we advocate assessment, so triage assessment, understanding what community resources are available. So if you live in an area near hurricanes, understanding where people can evacuate. You might be the first responder. So here are the areas that we first respond, right? Case finding and referring, prevention, health education, surveillance, and triage. Nurses working in a shelter provide assessment and referrals. They meet healthcare needs such as helping clients get prescription glasses, medications, first aid, and appropriate diet. Somebody who's diabetic and had to evacuate their home without their diabetes medication, that's something we need to ensure that they get. Somebody who needs supplemental oxygen. Medications that people need, people's Lasix, they need their Coreg, they need medications to control their heart rate. You need to keep their client records. Ensure that the emergency communication doorways are open and providing a safe environment. And then recovery. This is about returning to a new normal with the goal of reaching a level of organization that is as near the level prior to the disaster as possible. It's probably the hardest part of the disaster, and it occurs as all involved agencies pull together to restore the economic and civic life of the community. So we teach proper hygiene and make sure current records of immunizations are current. Lots of diseases like to breed after disasters. We make referrals to mental health professionals. We're alert for environmental hazards. If there's an earthquake, there could be a gas leak. So keeping in mind that, assess dangers of live or dead animals, and then case finding and referring. So they continue to plan and train in all hazardous environments, regardless of specialty practice. The nature of disasters will retain the element of unpredictability. So now I'm going to show you a little video about case management during H1N1, which is the swine flu. And it got pretty crazy, and just a little information on it.
Disasters can strike a community or a whole country very quickly and without warning. It seems that we hear almost daily that floods, hurricanes, storms, mudslides, accidents, and civil unrest or war occur somewhere in the world. A disaster can be described as any human-made or natural event that causes destruction and devastation that cannot be relieved without assistance. Disasters can create emergencies that require health professionals to act quickly and effectively. Emergency preparedness is a key function and role for public health professionals, whose primary responsibility is to promote and protect the health of populations. Such professionals, along with the government, prepare, assess, and propose plans to deal effectively and efficiently with an impending disaster. This video will focus on the activities of public health professionals and their partners as they illustrate the stages of emergency management in a recent pandemic influenza outbreak. The stages of emergency planning, as outlined by the Canadian government, will be used throughout the video. However, one should bear in mind that these stages can be universally applied to any country and to any disaster or emergency. Pandemics are considered to be natural disasters that create emergency situations, which could rapidly escalate into disasters with high rates of morbidity and mortality. An influenza, such as the one caused by H1N1, is a highly infectious disease that attains the level of the pandemic when sustained transmission of the virus affects large numbers of people worldwide. It is the World Health Organization that will declare if a particular health problem is at the level of a pandemic. The history of pandemics is fascinating. One of the most famous pandemics was the Black Death, or the Plague, which occurred in the 14th century. It reportedly killed half of the world's population at that time. More recently, in the 20th century, pandemics have included the Spanish flu, the Hong Kong flu, and the HIV/AIDS pandemic. HIV continues to spread and cause devastation around the world. Let's look more closely at the H1N1 pandemic, which is featured in this video. In March and April of 2010, Mexico reported an unusually large number of incidents of respiratory illness, which was confirmed to be caused by the H1N1 influenza virus. Shortly after, more cases appeared in the southern United States, and Mexico was believed to be the point source for these cases. Very quickly, in fact by May, close to 2,000 cases of H1N1 were confirmed in 21 countries. The vast majority of these cases were individuals between 5 and 29 years of age. By June, the World Health Organization had declared the H1N1 influenza to be a pandemic. This was not because of the severity of the illness, but because of its very rapid spread. In addition to dealing with the prevention and spread of H1N1, countries were also dealing with the affected individuals and families themselves. However, planning for such a pandemic influenza had occurred long before this pandemic was ever declared.
Canada and the world has been in pandemic planning for more than a decade. And it starts with committees. It starts with committees at every level, hospitals and community, provincial, territorial, national, and global. so that they often worked in isolation. So that at the beginning, people were doing what they thought they needed to do. They all knew that they had to do something, but weren't exactly sure what. And over the past few years, there's been more and more coordination between different committees at different levels. So it was really only in the past year or so when we really began to see that there would be a pandemic virus. We didn't think it would be what it was, but we knew one was coming. That people began putting more effort into operationalizing the plans, so that when the pandemic hit, we had a lot of plans already in place, a lot of stockpiling already in place, a lot of policies and procedures drafted. It was only when the virus actually hit that we knew what needed to be done and really operationalized it. It's important to prepare for a pandemic the same way it is to prepare for anything else. It's better to be proactive than reactive. We want to minimize the impact of the pandemic, reduce mortality, make sure people have the supplies they need and know what they need to do and they're able to do it. That kind of reduces the panic at the time and makes the whole process a whole lot more effective when we're actually in a pandemic.
Let's look now at the process of emergency management and follow this process as it pertained to the H1N1 pandemic. The goal of emergency management planning is to strengthen resilience. This goal is attained by way of an integrated and comprehensive approach that includes the four pillars of prevention and mitigation, preparedness, response, and recovery. However, before we look more closely at these stages, we should address who is involved in preparing for an emergency such as the H1N1 pandemic.
It's a cast of thousands involved in pandemic planning. Internally, within a health authority, generally the lead for pandemic planning happens within public health. But then we would be working, and over the last 3 to 4 years before we were actually into the pandemic, we had been doing a lot of pandemic planning with acute care, with long-term care. There was a liaison committee with the community partners, such as municipalities, school districts, personal care homes, child care centers, those groups. There are different types of public health professionals involved in preparing for a pandemic. So we can start at the medical officer of health, who would be responsible mostly for policies and coordinating communication. There's also the frontline workers at the other end of the spectrum, so the community health nurses, public health nurses. They would be involved with vaccination clinics and with public education. There'd be managers who would be coordinating the activities throughout, and there'd be epidemiologists who would be coordinating the surveillance and reporting, so we would know what's going on. Even businesses were involved in pandemic plans. They all had plans of their own, what to do in their own particular environment to reduce transmission, what to do with people who were sick and who could cover for them and that sort of thing. Within the university, we had plans on what do you do if your teachers are sick, if your students are sick, and so on. So almost everybody in society had some kind of planning. Certainly the health sector was the most elaborate, but everyone knew it was coming and did at least something, such as putting out hand sanitizer or wipes to clean surfaces and so on.
The first pillar of emergency management is prevention and mitigation, two activities that are carried out with the intention of reducing risk. For example, in the case of H1N1, it was important to assess and report the beginning of the pandemic, then to educate the public about the possible effects of the pandemic and what they could do to decrease their vulnerability.
Globally, the main initiative was actually surveillance, to identify what the virus was, where it was occurring. Without surveillance, we would have never have gone to a level 6 pandemic. And so they needed to know where it was and if it was the same strain, that it was an unusual strain that it hadn't been seen before. There had been a lot of preparation in the labs throughout the world in terms of their ability to identify the strain and isolate it and report that back to WHO. So I'd say global efforts were largely surveillance, whereas individual country levels was more about the care, the vaccination programs, and public education. Although globally stay at home if you were sick was a key message, and hand hygiene, and cover your cough. Those were our key messages in the province, and they're pretty much what the messages were worldwide. And there are different ways of getting them to do that. So, for example, you would see the alcohol pasting.
I am Mark Waldorf, and we are at the APHA and from the Global Nursing Caucus. And I'm Kelly Wolf, and we are public health. Absolutely. And our favorite part of public health is actually public health, the combination of public health and nursing. And the way that we do that is through the Global Nursing Caucus, globalnursingcaucus.org. Check us out, and our mission is to pull together anyone who's interested in nursing and public health and really move the whole profession forward through advocacy, collaboration, and working towards a greater mission of public health for all.
I'm Alexandria Rio. I'm a student nurse at Villanova University. I'm a senior this year. I've traveled to Nicaragua 3 times for public health.
Hello, I'm Dr. Sharon Bryant from the Denver School of Nursing at Binghamton University. I'm a associate professor, and my research focuses on anti-partner violence on campus and on health promotion behavior among vulnerable populations, and I am public health nurse.
Hi, my name is Amanda Fallon, and my research focuses on tobacco control policy making, and I am public health nursing.
Hi, I'm Dr. Gail Spencer. I'm a distinguished teaching professor at Binghamton University, and I'm the Decker Chair in Community Health Nursing. My research interest is in domestic violence, dating violence, and health promotion for prenatal and mothering women. I am public health nursing. Hi, I'm Marjorie Buchanan. I recently retired from the University of Maryland School of Nursing and have started a new consulting project entitled Public Health Networks, focusing on community and program development and evaluation. And I am a public health nurse. Hi, I'm Sondra Opalwall from University of North Carolina at Chapel Hill School of Nursing, and I have had a wonderful career with public health nursing and hope to continue, and I try to help nursing students develop that passion to integrate public health in their everyday nursing care, no matter where they end up working, so that they protect lives, prevent disease, and help communities and groups live well. Hi, I'm Terry Moore. I'm from Malloy College, and I am interested in working with children with asthma, and I am a public health nurse. My name is Dr. Nana Hancock McDonald. I'm an assistant professor at Fairmont State University, West Virginia, a graduate of State University of New York and Binghamton School of New York. My area of interest is domestic violence and rural health. I have done research in domestic violence. I'm Pamela Alexander, a doctoral candidate at the University of Pennsylvania School of Nursing. My dissertation work looks at the effect of emotions on sexual health, sexual decision making, and sexual experiences among young women. Hi, my name is Rosa Darling. I'm a PhD graduate of Binghamton University Decker School of Nursing, and right now I am a clinical assistant professor there. My research interests include maternal child and birth outcomes in the premature and neonatal populations, and health policy.